My name is Kim Brooks. I'm a member of the Taku River Tlingit First Nation, and it's my honor to serve as the Vice President of Regional Operations for the Vancouver Coastal Region. I acknowledge that I'm on the unceded lands of Squamish Nation in West Vancouver, British Columbia, and I'm truly grateful to be allowed to conduct my work here. Our work in the Vancouver Coastal Region over the past year has continued to be shaped by the challenging realities and urgent needs created by concurrent public health emergencies. It has been our honor in the Vancouver Coastal Region to work alongside community leaders and staff who've worked tirelessly while living through these crises themselves to maintain community safety and wellness. We continue to support communities in responding to the ongoing and devastating impacts of the toxic drug crisis. Over the past year, we've worked with provincial and regional teams to streamline our harm reduction and toxic drug response. In collaboration with several nations in the region, we also work to educate and train staff in the utilization of safer consumption tools and naloxone training to respond to an opioid overdose. We responded to COVID-19 in partnership with the communities we serve, as we've done since the outset of the pandemic in 2020. This included supporting managing clusters of COVID-19 cases in community by supporting isolation where needed and transportation to medical appointments or treatment. We worked with communities to distribute rapid testing kits and administer COVID-19 vaccine doses, which included the primary series as well as booster dose planning and rollout. The pandemic has been difficult, but it has also created space for shared learning and preparation for emergency disease control. We're truly grateful to all community health directors for their continued dedication and hard work. We continue to streamline our communications pathways, working to reduce duplication of information and ensure communities have access to the most current and relevant information and tools. We prioritize the ongoing implementation of the First Nations-led primary care initiative by supporting Newhawk Nation to submit a preliminary analysis report, which identified service gaps and a high-level vision of the primary care center, by working with Litwat and Southern Statlam Health Society on their enhanced community engagement on primary care, and continue to support LUMA, our first primary care center in the region, as they implement and improve their services. We continued planning for the new treatment and wellness center to be built in our region. Over the past year, we supported a community-driven, nation-based approach to site selection, which resulted in the selection of Shuswap Nation territory as the location. I'm so grateful to all of the participants who helped us make this important shared decision. While pandemic response continues to be a top priority, health emergency management and cross-collaboration is increasingly a focus for all health regions and is no different for Vancouver Coastal. During the 2021 wildfires, our regional team was honored to host and support community members and families who'd been evacuated from their homes in the interior region. In our planning for 2022 and to become more future-proof, we've continued to work in partnership and collaboration with not just other regional health teams at First Nations Health Authority, but also regional health authorities and partners, both governmental and charitable organizations. We know it's important to keep an eye to planning for the future. As always, we rely upon our communities to provide First Nations-led planning, and we were happy to bring forward our refreshed Regional Health and Wellness Plan at the Spring 2022 caucus that included extensive community participation and input. It's my honor to provide this brief message on behalf of our regional team, and I offer my sincere gratitude to every person who's contributed and will continue to contribute to this important work. To find out even more about how our region responded to the events I've mentioned, be sure to read our annual report located at FNHA.ca.